Food is meant to be enjoyed, but sometimes food can cause problems. Some people have trouble digesting certain foods. This can be due to a food allergy or a food intolerance. Both conditions can cause discomfort. It's important to know the difference. This way, you can stay healthy and enjoy your meals. Let's learn about food allergies and intolerances. We'll see how they are different, and we'll find out how to manage them. Food allergies and intolerances are common. They affect people of all ages. But don't worry, there are ways to manage these conditions. By understanding them, you can live a full and enjoyable life. Now let's dive into the details of food allergies. This video is for educational and entertainment purposes only. It is not medical advice. Food allergies happen when your body's defense system, the immune system, overreacts to a harmless food. This overreaction can be quite intense and can lead to a variety of symptoms that can affect your daily life. Imagine your immune system as a guard dog, always on the lookout for potential threats. It's supposed to protect your body from harmful invaders like germs, bacteria, and viruses, keeping you safe and healthy. But in a food allergy, the guard dog mistakes a harmless food, like peanuts, for a dangerous intruder. This mistake can cause a lot of trouble. When you have a food allergy and eat that food, your immune system goes into overdrive, thinking it needs to defend you. It releases chemicals like histamine, which are meant to help fight off the perceived threat. These chemicals cause the symptoms of an allergic reaction, which can be very uncomfortable and sometimes dangerous. These symptoms can range from mild, like hives or itching, to severe, like difficulty breathing or anaphylaxis, which is a life-threatening condition. Some common food allergens include peanuts, which are one of the most well-known allergens. Other common allergens are tree nuts, milk, and eggs, which are found in many everyday foods. Additionally, soy, wheat, fish, and shellfish are also frequent culprits of allergic reactions. It's important to remember that even a tiny amount of the food can trigger a reaction in someone with a severe allergy, making it crucial to be vigilant about what you eat. Now that we understand food allergies and how they affect the body, let's move on to food intolerances, which are different but also important to recognize. Food intolerances are different from food allergies. They don't involve the immune system. Instead, food intolerances happen when your body has trouble digesting a certain food. This is often because you lack an enzyme needed to break down that food. For example, people with lactose intolerance can't digest lactose, the sugar in milk. This is because they don't have enough of the enzyme lactase. This can lead to symptoms like bloating, gas, and diarrhea. Food intolerances are generally less serious than food allergies. They don't cause life-threatening reactions like anaphylaxis. However, they can still be uncomfortable and impact your quality of life. In the next section, we'll explore the causes and risk factors for both food allergies and intolerances. Scientists are still trying to understand exactly what causes food allergies and intolerances. This is a complex area of study, and researchers are constantly uncovering new information. However, they believe that both conditions are influenced by a combination of genetic and environmental factors. These factors can vary widely from person to person, making it a challenging puzzle to solve. Genetics plays a role because allergies and intolerances tend to run in families. If your parents or grandparents had these issues, you might be more susceptible. If you have a parent or sibling with a food allergy, you're more likely to develop one too. This familial link is a significant clue for scientists studying these conditions. But genes aren't the whole story. There are many other factors at play that can influence whether or not someone develops a food allergy or intolerance. Environmental factors also play a part. Our surroundings and daily habits can significantly impact our health. Some experts believe that our modern lifestyle may be contributing to the rise in food allergies and intolerances. The prevalence of processed foods and fast food in our diets is a major concern. Factors like increased exposure to processed foods, antibiotics, and less exposure to germs in early childhood may be disrupting our immune systems and gut bacteria. This disruption can lead to a higher likelihood of developing allergies. Now that we have a better understanding of the causes and risk factors, let's move on to how these conditions are diagnosed. Understanding the diagnostic process is crucial for managing and treating food allergies and intolerances effectively. Diagnosing food allergies and intolerances can be tricky and often requires a multifaceted approach. This is because the symptoms can be similar to other conditions, making it difficult to pinpoint the exact cause. If you suspect you or your child has a food allergy or intolerance, it's important to see a doctor as soon as possible. To diagnose a food allergy, your doctor will likely ask about your medical history and perform a thorough physical exam. They may also recommend tests like a skin prick test or a blood test to check for antibodies to specific foods, which can help identify the allergens. Diagnosing food intolerances can be more challenging because the symptoms are often less immediate and more varied. This is because there's no single test that can definitively diagnose a food intolerance, unlike food allergies. Your doctor may recommend keeping a detailed food diary to track your symptoms and identify potential trigger foods over time. They may also suggest an elimination diet, where you eliminate suspect foods from your diet and then reintroduce them one by one to see if your symptoms return, which can help identify the problematic foods. Special thanks to Wikipedia for providing a structure of knowledge. Thank you for watching our channel. If you found this video helpful, please like, subscribe, and hit the notification bell for more insightful content. Stay tuned for our next video.